going to talk about micronutrients, and today is going to be spotlighting blood pressure. How many people have had blood pressure problems here? I want you to wave your hand if you had blood pressure problems. How many people have found these products have helped them out when it came to your blood pressure problems? Wave your hand. I want everybody to look on this. Everyone wave your hand, especially since the micro daily powder came out, that you've seen some crazy results with your blood pressure. Wave your hand. We got some people that have. Now, let me give you mine. And by the way, we can mute everyone. Let me give you a little story about mine. I've been on blood pressure medication for as long as I can remember. In fact, lisinopril has been my friend. I used to take it every day, every single day. Now, I'm not encouraging people not to take it because I still take it. But what I did notice with the micro daily powder, daily powder, that it actually started dropping lower than I wanted to drop. And what I had to do, this is personally, anecdotal, as mentioned, and I actually had to take it every other day so that my blood, because one day I'm sitting up saying, man, I just feel like and so I did my blood pressure, and I saw my blood pressure lower than I've ever seen it. And all of a sudden next day I went there every other day, and then all of a sudden I saw how wonderful our micronutrients are when it comes to blood pressure. Now, those of you that waved your hands, if you have that inspiration to tell your story today, I'm pretty sure our moderator and our host today, which is Jonathan Jones, and you're going to be talking to Kedar Prasad. Kedar Prasad has done some amazing things in his lifetime. This is the first time I've ever been with a company and products that the company does 10 times more than everything I can describe. For the first time in my life, since I've been in this industry, I literally talk about a product and people ask me, hey, Bernard, what would this product do for me? I say, I don't know, because every time I talk to someone, it does something different. And everybody always come back and tell me how wonderful these products are. And that's the reason why you see so many people keep coming on here every Sunday, because Sunday at 5 o'clock, by the way, if you haven't invited your relatives and your friends, you need to do that. Because right now, health is one of the biggest things going in our lives. Now, I'm gonna give you a fact before we go into this. Did you know that over half America, half America, 122 million people in the United States are having blood pressure issues right now as we speak. And many people, even though they have blood pressure issues, they still just eat and do anything they want to do. And they don't think about the repercussions of when that blood pressure go up. And a lot of times it may even result in a cardiac or a brain issue. So the results are a lot of people are reactive than proactive. If you came on here today, you're obviously proactive. So let's give our attention for the next 45 or 50 minutes, because you're going to have questions at the end. You usually get a chance to ask it. Let's give our attention to our host and moderator, Jonathan Jones, as he interviewed, in my opinion, one of the most brilliant men in the world that has dedicated his life to actually making sure that we live a better quality life as we deal with the amazing conflicting ideas out here when it comes to our health. So Jonathan Jones, we're looking for you to help us to appreciate how micronutrients, spotlighting blood pressure, can help us to live a more quality life. Jonathan, you got it.
Thank you very much, Bernard. I certainly appreciate your fine introduction. For the record, today is September the 17th, September 17th, 2023. And it's a good time to be talking about blood pressure. Very soon is going to be Heart Healthy Month and Breast Cancer Month and all kinds of months. They have a month for everything. But, your health doesn't take a day off. And if you have health issues, we should be concerned about that every single day, because something is trying to undermine our health every single day. So that's the reason why we take the time to try to share with you information that we believe will make the difference for you. My wife and I started a company, a nonprofit organization called the Healthcare Support Association of America. Shortly after my mother died, it was called Cellular Health Foundation at the time, because we were both kind of taken aback by the fact that the medical system, when my mom was in the hospital in intensive, I asked what they were doing for her, They simply said, well, we're monitoring her very closely. And I was a little disappointed with that. So I think that people need to know about natural things that could potentially make a difference for them. So we're now trying to pass along information that will be a benefit to you. All the doctors that I've interviewed, medical doctors that I've interviewed, all say the same thing, that they really wish that their patients would be more actively involved in their healthcare. They don't want them to become Google doctors, they say, but they do want them to be involved. They want them to be mentally and emotionally involved in their healthcare rather than just completely accepting or expecting that the doctor is going to do everything for them. The doctor is going to, magically somehow cure them of all of their ailments. So the doctors say that if their patient is mentally, emotionally involved, then they can very clearly articulate when something isn't quite right, when they notice changes in their body, and they really want them to be compliant. So Bernard made a good point there when he said that it would be wise. No one ever is telling you to stop taking your medication. Make sure that you seek the competent medical advice of professionals that you trust. You see that our theme is micronutrients. We're spotlighting blood pressure. Now, we're not talking about any products. In fact, just to make it real clear, the FDA has not evaluated any of the statements that we've made that we're going to be making here today. So I always just try to bring that out to everybody. So you're going to be hearing testimonials. Testimonials are purely anecdotal. They're atypical. What happens to one person may or may not happen to you. So engage myself, Jonathan Jones, Dr. Prasad, none of the Engage Global personnel, affiliates, or corporate members are making any claims that Micro Daily or any of the Engage Global products will cure, treat, or heal a person from any disease. We strongly, strongly, strongly recommend that you seek the competent medical advice of professionals that you trust. And just for the record, I'm a researcher. I'm not a medical doctor. Don't do anything I say because I say it. I'm simply passing on to you information that I have learned over the years. And I'm excited to be able to interview a gentleman who has been the educator of doctors. So, but before I bring Dr. Prasad on, let's give you a little bit of background information about blood pressure first, so we can just hear from Dr. Prasad exactly, what he will be sharing with us is the effect that micronutrients can have on the body. So here's the definition of it. It's when blood vessels when there's pressure pushing against the walls of the arteries. In this picture you're seeing here, it's caused by a blockage, a partial blockage, a buildup of plaque in the coronary arteries, but anything can cause some slowdown or obstruction, but it's when the blood vessels are pushing against the artery walls, that's what causes high blood pressures. And the purpose of arteries, it's to carry blood from your heart to other parts of your body. So this is all from the CDC's website, by the way. Blood pressures normally rise and fall throughout the day, but it can damage your heart and cause health problems if it stays high for a long period of time. Hypertension, which is also called high blood pressure, is blood pressure that is higher than normal. So your doctor tell you what are normal rates, and Dr. Prasad may mention to us what's normal rates, but most persons who see that their blood pressure is around 120 over 70 or 120 over 80, you know that you're pretty much in the normal range. I still remember the last time I went to have a blood test. The doctor who, when the nurse told him what the blood pressure was, he looked over me and said, one of the lucky ones, because my blood pressure apparently at age 60, 61, whenever that was, I took got my last labs done, was in the category of someone in their 20s. So, and I said, there's nothing lucky about this. I didn't want to contradict the man, but I've been working on keeping my blood pressure normal for a long time and making sure that micronutrients were part of my diet. So, but those were his words. He thought it was a rare thing to, for someone at my age to have what was considered a normal blood pressure. So here's the reason why you want to be concerned about it. Now, the number one thing that's mentioned here from the CDC is that having high blood pressure puts you at risk of heart disease and stroke. Mm-hmm. And you probably already know this. It's the leading cause of death in the United States. They've been studying heart disease for more than 120 years now, and it's still the number one cause of death. So a person who's dealing with high blood pressure is they're like on a skateboard heading straight toward the number one cause of death in this country. So in 2021, the latest figures on their website said the 691,095 deaths in the United States was attributed to hypertension as the primary contributing cause in 2021. That should blow your mind. It blew my mind, to see that figure. That's nearly almost 700,000 people died because of a condition that is actually preventable and treatable. Anyway, half of adults in the United States, it says, have hypertension. So 120 million people. 1 in 4 adults with hypertension have their hypertension under control. So that's what it says on the CDC's website. The cost is $131 billion every single year. What a strain on the economy. But that also gives you another clue. Whenever you see a number, a dollar figure associated with the number of people who are having a health issue, just be aware that that means someone, if it's costing somebody something, somebody's earning something. So it's part of keeping the economic engine going as well. So just keep that in mind. I took this from the CDC's website also, and it just gives you a snapshot of the percentages of the prevalence of hypertension around the country. So the darker the color, the darker the red, the higher the prevalence. But as you can see, there's almost no place that is untouched. The only place that looks like it's untouched is New Jersey. And you and me both know that that's not because there's nobody in New Jersey with high blood pressure. Somebody just didn't write that down. Someone didn't collect the information. That's why it says insufficient data. So they just didn't put any color on there at all, but it might as well just colored it in dark red, just like the rest of, the north area up there, because everything north of Delaware is considered New York if you're from the South. So, but anyway, that's just what's shown here. So that's the prevalence. Now, I thought it might be good too to share a couple of pieces of facts before I introduce Dr. Prasad. So the Mayo Clinic had what I thought was a nice comprehensive piece of information as to exactly what causes high blood pressure. And I was blown away personally, because for the first time I see it in writing that they admit that they don't know something. Look at what it says. Now, there's 2 different kinds of hypertension. There's primary and secondary hypertension. The first one, it says there's no identifiable cause of high blood pressure for most adults. No identifiable cause. I used to hear doctors say that, and it was kind of mind-boggling to me that they could actually say they really don't know the root cause. But that's what they say here at the Mayo Clinic. Dr. Prasad may have some more information for us, I'm hoping. So we'll see what he can share with us. And it says this type of high blood pressure is called primary hypertension. It tends to develop gradually over many years. Plaque buildup in the arteries, called atherosclerosis, increases the risk of high blood pressure. That's the primary. Now, what about the secondary hypertension? Look at the list. Look at the list. Pay careful attention to the list of what could potentially cause secondary hypertension: adrenal gland tumors, blood vessel problems, cough and cold medicine, some pain relievers, birth control pills, and other prescription drugs. Now, if I could, I would highlight that, and maybe my computer will let me highlight that line right there. But I want you to make a mental note of that third line there, that on the list is other prescription drugs that could cause high blood pressure. Illegal drugs also can cause it. And then kidney disease is mentioned there as a potential cause of high blood pressure. Interesting. And the reason that should stand out as interesting is because there's a story that we're going to share with you where kidney disease was very much connected to the issue. I still remember one of my moms. This was one of my mom's close friend, like a spiritual mother for me. She had high blood pressure. I remember seeing her a couple of years before she died, and I said, "Well, you look terrible. How are you?" She says, "I can't get my blood pressure under control." So I handed her a bag of Micro Daily Hydro. And about a week later, she sent me a text. She was so excited. She was on 3 different blood pressure medications. And she said she could not get her blood pressure under control. She sent me a text message. She could not believe how low her blood pressure had gone. She was so excited about it. So maybe finally she was getting something that could help her. But the next week she went to talk to her doctor about it. And the doctor told her to stop taking it because it was interfering with his treatment. So she gave me the product back. And within 6 months, she was on dialysis, and about a year later, she died. So I'm pretty sure that the doctor was well-intentioned when he gave her the medical advice, and maybe he had reasons that I'm just not aware of, that for him to tell her to take something, to stop taking something that, in my opinion, was helping her, and according to her, she was benefiting, from it. So I'm not sure why that happened, but I can tell you that she died within 2 years. When she clearly saw that something was benefiting her. So keep in mind, again, that testimonials are purely anecdotal. So what happens to one person may or may not happen to you. But I do want to share one story with you where buried in this story, you're going to hear a number of things, but have your ears peaked to high blood pressure and be listening for kidney issues. Just listen to those things as you're hearing Greg Ballew tell us his story about himself, his mom, and his brother-in-law, and you'll find it quite interesting that he kind of mixes it all in together. Just try to separate that and listen to that part of it if you can. Okay, so 1 second here. I think we got Greg up already, but I got to give you some sound. Audio. You told us that you noticed some things in your health, your brother's health, and your
mother's health.
And your mother's health.
Yes.
Okay, so you got some updates for us, or you're just going to give us an overview again and then give us the updates?
All right. Now, my mom's got COPD. She could leave her bedroom and go to the bathroom and be out of breath completely. She'd have to basically sit down to take a break while she goes to the bathroom. So, because she had to get her breath back to get back to her room. All right. Now, this was in July. All right. My brother-in-law, he's got diabetes, high blood pressure, and stage 4 kidney disease. Okay. And they both been on Micro Daily about, I'm going to say about a month and a half total. Okay. They started in, let's say, August 6th. So September, about a month and a half, almost 2 months. And my mom, the other day, I was on a Zoom call when my good friend, he's on here, it's Willie G. And she was like, hey, I'll be back in a minute. I'm going to go to the vet to get a flea pill. So each day she's been walking farther and farther and farther. And now she can go and shop at Walmart, walk around the Walmart Super Center and come home and without being out of breath. And I'm sitting here like, well, and she really don't see it, but I see.
That's amazing.
Okay. Now that right there is an A+ for her. Now I got her on the prebiotics for her stomach, health, gut. And she is energy and 78 years old, walking around cleaning the house and everything, like nothing's wrong with her. All right. That's my mom. Me, myself, I got more energy. I'm focused. I'm I was healthy to begin with, but the reason I got on Micro Daily for myself is because I don't like being sick and I don't want to be sick. So that's the reason I started taking it. I was like, okay. And there's a long story that Rob called me and I told him, I said, man, I don't do products, dude. I don't do them. He said, hear me out. Just test it out, man. Just test it. I was like, okay. So I got some of it, put it in. I was like, okay. About 4 or 5 days later, okay. About 2 weeks later, I'm like, man, I used to wake up hating the world. There's two things in life I hated to do was go to sleep and waking up. Right? And because I knew when I wake up I was gonna be ill. And So now I wake up fresh, loving everybody. Hey, what's up? You know, Willie don't even have to ask me if I'm good to go to get on a Zoom. He just sends me a Zoom link now. So, but anyway, that's me. Now, my brother-in-law, man, I don't even know what to say about this. His blood sugar is leveled out. He's still at 114, 125. That was, you know, before when he woke up, he tested it, and it was at 300, 350. After about 4 or 5 days of being on micro daily EMF, it went down between 114 and 125. He was happy just about that. All right, now his high blood pressure has leveled out. Okay, to where, you know, he's scared to take his medicine for his high blood pressure. I said, no, go ahead and take it, dude. I said, you take your medicine, let the doctors tell you not to take it. All right. Now, yesterday, he's got stage 4 kidney disease, and he's going Wednesday for his checkup on it. He went and got his blood test, and we've been waiting on the score back from it's called the EGRF number, which tells you when you need to go on dialysis. His number last month was 15, which is 1 away from going on dialysis. Last night, when he got back yesterday, we checked his my chart. You ready for this, man? He'd been on it a month and a half. His number went from 15 to 26.
Did the doctor go back and check it again just to make sure?
We ain't went to the doctor yet. That was they sent him for a blood test a week before his appointment. So I myself is going with him on October the 5th to his appointment, and I want to see what the doctor has to say about what he's been doing.
I'm gonna stop Greg Ballew right there.
Make sure you tell doctor what exactly he's taking.
Yes, I believe he made very clear to the doctor what he was doing, and that's what made the whole thing just very, very exciting. But as you can see, he goes on to just describe a few more things about himself and his mom and the brother-in-law, but clearly he made the connection. They are all making the connection, the coincidental connection between adding micronutrients to his life, to their lives.
Yep.
Seeing all kinds of benefits in there. So again, for the record, folks, testimonials are purely anecdotal. What happens to one person may or may not happen to you. So I said all that to lay the foundation for us to be able to hear some comments from the godfather of micronutrients, Dr. Prasad. We're very fortunate to have him with us. Dr. Prasad has a storied background. He was the professor of the University of Colorado School of Medicine for 30 years, the former president of the International Society of Cancer and Nutrition. He was also a member of the Royal Society of Medicine in London, and he was he was invited to be on the Nobel Peace Prize nominating committee for candidates in medicine. So he's recognized on the world stage when it comes to science. He was the world's first radiation biology PhD. His products have been awarded 8 US patents on micronutrients. He's the gentleman who discovered the anti-cancer potency of vitamin E succinate. He's also credited with discovering that butyric acid, the small fatty acid formed by fermentation of fibers in the gut, is an anti-cancer agent. Dr. Prasad has authored or co-authored some 33 books. He's working on another one as we speak, and he's also been published more than 250 times in peer-reviewed publications. So that means that this man has thought up more than 250 things that other scientists hadn't even let come to mind yet. These are just some of the books that Dr. Prasad has written. And I say some of them because it's really just a snapshot, a cross-section of a few of them. And you'll see that the heart is mixed in there. And of course, along with that, you know the connection, because we just showed you that the CDC says hypertension eventually leads to the #1 cause of death, which is heart disease. But I'd like to encourage everybody to take a snapshot of this screen right here and go grab those 2 books. The one on heart fighting fighting heart disease with vitamins and antioxidants. I apologize that I didn't replace that one on this screen for this particular meeting, but you can search on Amazon for that one also. My wife has been going out there searching and finding them, and I'm buying them up and adding them to our library. But his latest book there, the one on dementia and memory loss, how to prevent and improve treatment, I highly suggest that you go get that one. That QR code will take you to that one. So do that now before you forget. It's an educational book, pun intended. Written for the public, it provides easy to follow guidelines on how to avoid the risk of memory loss. The book also provides recent scientific information on how to reduce the risk of memory loss and how to improve current drug treatments with the help of micronutrients. So it is my privilege and my pleasure to invite to our discussion Dr. Kedar Prasad. So Dr. Prasad, once again, thank you very much, sir, for joining us in our discussion today.
Thank you, Jonathan. I always enjoy discussing with you and with your colleague about topic that you decided today or any topic that you selected, and I'm always privileged. And one thing I want to say that, I don't know, 10, 15 minutes, my granddaughter might walk in the house and she's leaving it, so I might interrupt for a few minutes just to chat with her. So
Okay, no problem.
pardon me, if it happens, you will take care of,
No problem at all. We'll share another story or something while you step away. So no problem whatsoever.
exactly.
There, sir. So while we have you, tell us this: when you hear stories, like my spiritual mother, who got benefits, stopped taking it, and ended up very, very adverse outcome. And then you hear stories like Greg Ballew telling 3 different stories, one of them that included high blood pressure. Can you go ahead and start to connect to us why?
Yeah, I think, again, central issue, if you look at for all these kind of diseases that you mentioned, there are, of course, this is a treatment issue. Prevention is different issue that we can discuss later. But for the treatment aspect, there, in all symptoms that you mentioned of blood pressure, which leads to a blood pressure, in those cases, increased oxidative stress and increased chronic inflammations are involved. That's the central issue.
Right.
And of course, most recently it came out that if you have a deficiency of omega-3, which is a fatty acid, it is also not a micronutrient, but it is a different group of nutrient, but it's essential nutrient. Your body needs it. And deficiency in this case can increase the risk of blood pressure, many other diseases, including blood pressure. Mm-hmm. And so the question is, even the micronutrient alone, like we were taking it, hydroform. And hydroform is important under acute disease condition because they are absorbed quickly and distributed rapidly throughout your body. So I'm not surprised that many times we have seen people who have a end-stage disease, kidney disease, and if they have kidney disease, I presume they had a diabetes, because seldom kidney disease occurs by just having an injury to the kidney. Most of the time, kidney disease is associated by progressive diabetes because they could not be controlled by medication they were using it.
Yep, true. I think in all cases, diabetes was connected, including my mother.
Yes. Mm-hmm. So that's and as you know, diabetes is if you should have an early intervention, probably it would not have developed any end-stage kidney disease, or like in that case, it had eGFR, which is the measurement of kidney function.
Right.
And you are supposed to be a lot like 70 or 80, normal person. And his head was 15, but at least his 10 point went up. That's amazing. That even at that later stage.
In just a few weeks.
And just a few weeks. And if you reduce oxidative stress, it is not like medication that oxidative stress and inflammation causing, whatever they are causing it, will be immediately arrested. You have a gradual procedure. And so the effect will be also gradual. And so the fact that she got so quickly, I'm surprised. But anyway, you will see that as it progresses, it will improve further and further. And As you know, that one of my friend, Dr. Cole, who had a kidney transplant, and doctor said that you have to 17 months, maximum 17 years, will survive. And then he survived more than 30 years because all the time with me, he was working, and whatever I was taking micronutrient, he was taking it. And as you know, he was also together with when we formed PMC and so on and so forth. And with me, he was also collaborating with the Department of Defense. So she was always with me. And so he just, for a long time, he survived. And then, finally, because sometimes he used to have a lot of marijuana smoking and all this kind of habits he had. So sometimes, but anyway, he survived for a long time. But the point I'm trying to say that the micronutrient is very useful in the sense that it also stimulates your immune function. So while you are getting other things get rid of, say, for example, high blood pressure or diabetes or overall heart disease issue, at the same time, your immune function is better so that you can find new emergent. Now there is a new virus in India. Sometimes a new virus somebody else is emerging. So you don't know. Here also, there's some state have some new viruses. So these are the facts, just like a EMF radiation. These are all the facts of life.
Right.
So the question is how you protect yourself. One and only way you can protect against viral or bacterial infection is keep your immune function optimal. How do you do it? Take a good diet, do exercise, and have a micronutrient supplement that we provided. That's the easy thing to do. But sometimes it's difficult to change your lifestyle, difficult to change your dietary habit. But this is easy to do.
That's right.
It's very easy to do and implement it. Sometimes diet and lifestyle, no matter how important it is difficult to implement, like EMF. Now it is a 15 is coming up. This also increases heart disease. EMF radiation is a long term. And so, but you can't avoid it. This has become a part of life. As you know, France has banned illegal the Apple 12. And now we are already here, Apple 15 in the market. And people are buying. I'm getting advertisement all the time. And so these are the part of life that you can't avoid it. Just like environmental agent. Many times we have bad weather or a bad pollution air, can't avoid it. So what you can do the best, you can protect your system against, because all these agents cause oxidative stress, generates a lot of free radicals. And as well as in case of the in viral or bacterial infection,
Right.
they cause depressed immune system you have because of increased oxidative stress, then they will get you.
That's right. That's right. Well, that's interesting, Dr. Prasad, that you make the connection there between all these other different health issues, because I tried to underscore it there on the CDC's website that they mentioned prescription drugs as a potential cause for high blood pressure. So if a person has health issues and they're being put on a litany of prescription meds, they actually increase their potential for being getting
But
high.
I was surprised that doctor will say you stop taking it even though you are seeing benefit. Most of the doctor will say, go, whatever you are doing is very good.
Yeah.
That's what we heard. This is the first time I heard that any doctor will say, even though he's getting benefit, you stop what you are taking. That's a criminal act.
I think so. I think so. I thought it was absolutely diabolical, to be quite honest with you, and I couldn't believe it.
I think that doctor should have been sued for malpractice.
Yeah. In the state of Florida, and I think people need to wake up to this. This is the reason why it was so important for me to get started with educating people, was because I found out that very poor decisions were made by the doctors, and that's what led to my mother's death. So I contacted an attorney, and guess what? In the state of Florida, it's against the law for adult children to sue for damages when their adult parent has died as a result of negligence. So your best bet is to prevent and to not go down that road than to try to,
Yeah.
backtrack.
I mean, no, but many, we talk to many of our customers, most of these says, yeah, keep on doing. Looks like you are doing very well. That understand.
Yep.
But to say that don't take it.
Told her to stop taking it, Dr. Prasad. I told her to stop. She handed it back to me.
Yeah.
And I said, well, she's won't be seeing her for very long, unfortunate.
I just can't believe that any doctor will do that. But he must be the old doctor. But anyway.
I don't know. But whatever the case, she believed him. And so many seniors just 100% believe what their doctors tell them. And I'm not telling him.
I mean, as a patient,
go get a second opinion. Go get a second opinion.
Exactly. If doctor says don't do it, don't do it.
Right. But when something is helping
in this scenario, doctor is seeing the benefit. And I still do think. She should have consulted another doctor, at least.
She should have at the very least consulted another doctor.
Yeah.
And I tried to talk to her family.
But at that time, nobody does it like that. You just follow it, what doctors say.
That's right. That's right.
That's why I always tell to the my people who ask the question that in the event any doctor who has some reservation about anything, he can always call me and talk to me. I will talk to him or her.
Mm-hmm. Yep. Well, we'll see if we can get some folks to do that. And for the benefit of those who are here, these are some of the risk factors. Is this accurate, Dr. Prasad, that these are the risk factors?
Yeah, but because some factors are you don't have a control. For example, age, you can't do anything about it. Race, you can't do anything. Family history, you cannot do anything about it. But the other one you can do about it, obesity, overweight, this is in your hand. Lack of exercise, this is in your hand. Tobacco use. We have been talking about tobacco, don't use it, tobacco. Still many people are using it. But that's the most culprit is tobacco to increase not only your blood pressure, but remember, as a function of aging,
that's right.
The plaque forms in the inner wall of the arteries. And when it becomes too thick, then your blood pressure increases, like you showed in one of the picture earlier. And so, and I remember in a Maverick trial that we did, and there, even it was original micro daily. Today's micro daily is much more efficient, but even at that time, when we did a study, we saw that it prevented the plaque formation in the artery, whereas Lipitor did the same good changes in lipid profile, which is very important for heart disease, reduce the risk, but it did not do anything to prevent the plaque formation in the wall of the artery.
Carotid artery. Mm-hmm.
Carotid artery. And just microdaily alone, not even in combination.
Wow.
It's just alone.
Wow.
And so you can see that the micronutrient that we have in our formulation has a much more complex effect rather than just reducing inflammation or reducing oxidative stress or improving immune function. These are much more complex, some of which we can't explain why, but it happens. These are all happening.
Well, it's clear we're seeing it happen, and everybody's under stress these days. So that's a major contributor to the problem.
Drinking too much alcohol is well known.
And too much alcohol, yes.
And certain chronic diseases like kidney, diabetes, these kind of things will. Stress is another important thing because it releases ACTH hormone, and that increases all kind of diseases, including blood pressure. And so and the way you control stress is you go on vacation, be nice to your family, you know. Do meditation if you like, you do yoga, whatever way you can do it.
Take CBD. That's what I tell folks. You can take 2 CBD in the morning.
That's the easiest.
Night.
Another one is the non-toxic approach, which is in this case CBD, is very important to reduce anxiety, and there is a built-in mechanism why, and so as I mentioned, the most prescription drug used for reducing your anxiety and depression is the prescription drug.
Right.
But this has also toxicity.
That's right.
And
That's
those
right.
drugs,
Side effects.
the way they acted, that they act as an inhibitor of serotonin reuptake. So if it gets the uptake, it gets destroyed. And so it prevent the uptake of serotonin, then they stay as a neurotransmitter, stay around, and that affects it. And so CBD exactly acts like that prescription drug. It acts as an inhibitor of serotonin reuptake.
Mhm.
Plus, it also has a effect where the other prescription drug does not have. It also increases your dopamine level, which makes you happy. And so it has a double function. And so it is extremely important to have that. But now another thing is that they found that the omega-3 fatty acid, which people have not studied in the past, they also decrease anxiety and depression, suicidal tendency, and these kind of things. So omega-3 fatty acid has become extremely important for me and for many people. The only exception I say is if you are already on a Plavix, which is a antiplatelet medication, and also on a Eliquis, then you have to take only twice a week, not every day, because they also act as a blood thinner.
Right.
And but the important thing is that it is important, and if everything starts improving, doctor might say, well, you reduce the dose of Plavix or Eliquis, who knows?
Well,
But anyway, but for most of the people, it is very important also. So if you combine those things with omega-3, because they work on a different level.
Right.
Microdaily all affected, mediated by receptor in the brain.
I am happy to report, Dr. Prasad, my mother-in-law was here for a month. And while she was here, my wife was giving her 2 hydro EMF at least twice a day, sometimes 3 times a day.
Mm-hmm.
She just went back home about a week and a half ago, maybe 2 weeks. I've lost track because it's just been dizzy. But she went to the doctor, and the doctor has completely taken her off of her diabetes medication. No more insulin. She was completely blown away. This is a 92-year-old woman who will be 93 in just a couple of months, and the doctor just completely took her off of her diabetes medication.
That's amazing.
It'll be just another minute before her blood pressure.
I don't know how to promote all these things nationwide, because we don't have enough resources to go on television and things like that, But and also our aim is not to just make money, but to go through person to person for the benefit of the health and also financial benefit for those who work harder. So our philosophy is totally different, not make money. But sometimes we wonder whether how to publicize is more, but I have no idea because you guys are more in marketing than I know ever.
Yeah, no, we're working on that. We're trying to do that, and also my wife said I don't look good in orange, so we're trying to do it and stay out of jail. But here's the other thing that we have to try to emphasize too, for the sake of folks understanding the importance of getting a handle on blood pressure.
Exactly.
These are some of the things that this high blood pressure can cause. Is this all accurate? This is the Mayo Clinic's website, by the way, Dr. Prasad. Is this accurate?
Yes. Heart attack, number 1 after the overall cardiac vascular disease. Stroke is number 2 cause of death among heart disease. So it is very important. And the high blood pressure will increase the risk of stroke. Aneurysms, as you know, the blood vessel dilates and breaks up. That's can cause a lot of, especially in the brain, and it can lead to heart failure, a kidney problem, eye problem. This increased blood pressure is a very dangerous thing to have it, and it is very easy to control it. You just lose some weight, have some micronutrient, simple thing, do some exercise, not too much, And so I think people, if you want to educate people like this, you do some simple thing.
That's right. There are Tell us, because here we got Micro Daily now. Do you want to just share with us maybe one or two things as the reason how this will benefit someone? I love the fact that it's got the N-acetylcysteine. Because
Yes.
I saw the research that said that raising glutathione absolutely makes a big difference. when it
Yes,
comes
of
to
course. Yeah.
Oxidative stress.
Yeah. And I think, here is hydro form, and it is so quickly absorbed, especially like in your case, if person is 92 years old and have all these kind of health issues, I think hydro would be the best one for them.
Yep.
And,
it worked
until,
great for her.
yeah, until you hate hydro. And you can see that probiotics right here. And probiotics is extremely important for blood pressure or for any disease.
Mhm.
We call intestinal dysbiosis. Omega-3, now new kid in the block for us. It has been known for a long time, but at least for us, it is a new product. And I'm amazed at how much is, deficiency of omega-3 is linked to autism, ADHD,
I didn't know that.
depression, and anxiety. Yes, sir.
I did not know that. That's
Yeah.
interesting.
And I have included, as you know, I'm writing the book. I have started it, but I'm not. It is not like diabetes that I have submitted it. What is the difference between the age-related memory loss and dementia? What is the difference? How we can prevent each of them? What are the similarity, and so on and so forth. And while studying the micro daily and the omega-3, I found that this is amazing. So I have included in that book also omega-3.
Wow, look at that, folks. You need
Yeah,
another reason.
but I have
take
not
mine
included.
every single day. I do not miss, no question about it.
But this product was not available when I submitted the book on diabetes.
Mhm.
It is I did not include that. But here is one thing about this which is also important, because diabetes is also associated with high blood pressure.
Yes.
Omega-3 is important. For example, what happens if you have insulin resistant cell, say, then becomes insulin resistant, so glucose will accumulate. So there is no way glucose can go and because insulin receptor is damaged, so insulin cannot go there and bind it and phosphorylate another protein called ATK. That's the name of the protein. And so, because this is the job of insulin to do all those things.
Right.
But what omega-3 does, it directly stimulates ATK protein, phosphorylated. And as soon as that happens, the glucose transporter protein from the cytoplasm goes to the membrane and tell glucose, now you can come in.
You mean to tell me this behaves just like insulin?
Just like insulin. That's why it is very important.
Oh my goodness.
People who have insulin resistance, here is another agent which can do the job without
oh my
insulin.
Goodness.
Yeah.
Oh my
I was
goodness.
surprised. I was surprised myself.
Folks, I hope everybody got that, because you said that last week, Dr. Prasad, and I actually clipped out that portion, that sound bite, and added it to my frequently asked questions, because I wanted to get that clearer. You just made this abundantly clear now. Folks, Dr. Prasad just said that his research has shown that the omega-3 can act like a key to tell the cells to let the glucose in the same way that the insulin does.
Yes, exactly. Exactly.
Oh,
I was surprised myself to find that. So
that means then that by taking this, no wonder we feel increased energy when we take it, because
well, that's another thing, the EPA is very important for production of energy. So not only energy, but these things, so people who have a diabetes, like we are recommending before.
Oh, wow.
All these things combination. So this will be after. So now the 4 would become like first is micro daily, say hydro. And second would be the second importance would be the what do you call probiotics, and third would be omega-3 fatty acid, and fourth would be collagen peptides,
especially for diabetes. And it could
diabetes, Because collagen is very
be, Dr.
important for
Prasad.
diabetes too.
This very well could be the other reason why my mother-in-law has such dramatic results, because for the entire month, my wife was giving her all of those things, not just hit or miss when she's in Boston, not getting it consistently. Here, she got it religiously every single day. And just like that, no more insulin.
No, I think, so if somebody has already, most of your diabetes patients have certain amount of insulin resistance.
Wow.
But even the people who becomes resistant to everything, if you take, it is also important for prevention as well as treatment.
Wow.
So it is extremely important.
That's incredible. Well, Dr. Prasad, we have, we did want to try to share another testimonial with you. If someone has a testimonial, well, actually, we're out of time with that. We want to throw some questions at you now because we've got a bunch of questions that folks are asking.
Sure.
But at the exact same time, I just want people to understand, let me just give them a real brief as what Dr. Prasad, what you just told us about what to get and what in order of priority. If your budget can only afford the basic bundle, that's about $100. That's fine. If that's the best you can do is the basic bundle, the one that the girl is pointing to there on the bottom. But if you want to step it up a little bit, then Dr. Prasad just said that at least add the omega to it.
Right. That would
Add
be
the omega to the basic bundle. So take the basic bundle, add the omega to that. Then
Yes.
if you really want to just go to the best, then go straight to Dr. Prasad's Core 4 and
Yes.
add the collagen to it. Okay,
Yes.
so that's the order that you want to go in. And all of this, by the way, even the Dr. Prasad's Core 4, I think it's only about $200 is the total for that, maybe $210, something like that. And if you go with the EMF Hydro version of it, it's about $5 more. So it's not much different. So just take the bundle and just choose the one that has the EMF Hydro. It's much more absorbable. It does work faster. It is definitely more potent. So the person who invited you here today, they can help you to get started with this. Now, keep in mind, we're not talking about any of these products treating or curing high blood pressure. We are talking about these products benefiting the body by reducing, as Dr. Prasad said, oxidative stress. Then the body knows what to do from there.
Right.
The
Exactly.
body knows what to do from there. Be consistent with it. If you're not one of those ones that gets dramatic results right away, it's not the product's problem. And it's not your problem, not your fault. You just need more time, because look at all the contributing factors as to why and how your blood pressure got out of whack. And remember, there are things that you can do to make it better. So that would mean, do the exercise, do all the other things that you need to do to make sure that you can see the full benefits for yourself. Now, next week, we're going to be talking about stroke. So we laid the foundation for this entire discussion by talking about blood pressure. We're talking about stroke next week. So you can just kind of get yourselves ready for that. So let's take a couple of the questions before you have to go, Dr. Prasad. A bunch of them came up in the chat.
Sure.
And someone asked a question about stomach problems after post-surgery. What would you suggest to maybe accelerate the healing post stomach surgery and maybe to reduce bloating and reduce pain? Is there any suggestions you have there?
Well, first follow doctor advice, and second is the micronutrient is supposed to enhance the rate of healing. And if it is right now, and none of the, for example, probiotics would not interfere with your healing process. If anything, it will help. And omega-3 fatty acid, is omega-3 daily, we call them, is very important. And at this time, if you can't afford it, you don't have to take collagen peptides. But at least these three are very important for your healing process.
Mm-hmm. Okay, excellent. And someone else raised another question. Not sure if I got all of them, but there was a whole bunch of them that were flashing by there. What about CBD? Does it help with the abdominal pain?
It depends upon what kind of abdominal pain, what is the cause of the abdominal pain is. But if it is related to
post-surgery.
Or post-surgery. Yeah, CBD is always good because CBD reduces your anxiety and depression if you can take it and if you can afford it. And yeah, CBD would be a good idea to add it.
Okay, excellent. What about left ventricle atrophy? Can hydro help with that?
We don't have any data, but people have reported that sometimes those kind of issue, they get repaired, but we don't know. You try 90 days, microdaily EMF, not brain boost, but omega-3 fatty acid and probiotics for 3 months, and it doesn't improve, and follow the cardiologist advice, and then you will be okay.
Okay, that sounds good. Yeah, we had one anecdotal story of a mitral valve prolapse.
Yes, yeah, that's what I was.
It healed itself.
Yeah, yeah. So that's why I said try 90 days. 90 days is enough time to heal. And after that, then you decide what to do, what doctor says.
Excellent. And Rob asked the question, CBD, should it be taken an hour before bedtime, 1, 2, or more? And he's not on any pharmaceutical drugs at all.
No, I mean, before the bed, that generally half an hour before you take omega-3, either 1 capsule or 2 capsule, it is non-toxic, so it makes no difference.
Yeah, I've been taking 3 of them and I go into a coma. I get sound, solid sleep. I started with doing 1,
very important. Sound
got
sleep.
better sleep. I went to 2, it was deeper. 3.
Okay.
3 is the winner. So there is no other, you can't overdose on it. So one more question, Patricia, has someone raised a question here. How many CBD to speed up, say, resolving depression?
Yeah, I think, you can take up to, for example, 25 capsule, you can take up to 4 capsule, 100 milligrams without any problem.
Yeah, yep. I think there was one story we got from one affiliate who was taking 5 and 6 at a time. And she said that it helped her tremendously with her anxiety and depression.
Yeah, but only thing is that, if you are on some kind of medications, then what happens if you take high dose, and not up to 150 milligrams, for example, but suppose 200 milligrams or more, that it might inhibit the enzyme called 450 that breaks down your drug and metabolizes and remove from your body. And if that enzyme is inhibited by high dose of CBD, then blood level of medication can increase and cause toxicity. So except that, otherwise there is no toxicity up to 150 milligrams.
Wow.
In human, they have tried up to 750 milligrams, but these are all short-term experiments, And so when you take these things, you are committed for long-term. That's why I'm very conservative. And if you get a bifactorin 2, continue 2. If you get a 3, you can go up to 4 very easily.
And be patient. Be
Yeah.
patient and give it time to work, because some people think that it's going to just work like some kind of a
And
drug.
also in combination, do some exercise relieve it, also anxiety, do something, activity,
Yeah, very good for the dopamine, for the serotonin.
Yeah.
Okay, and someone said, is there a maximum amount of micro daily that a person can take?
Well, I think, if for prevention, for most of the people, it is okay. For cancer, preventive dose, like you say, you can take it twice the dose of prevention. This will be okay. But if you are a cancer patient with consultation with your oncologist, you can take it 3 or 4 times of preventive dose.
3 times the preventive dose. So, and it's not toxic.
No,
so,
not toxic.
Jeff said that he was giving his father at least 3 times the normal amount, 3 times a day, and he got outstanding results with his cancer. So,
yes, short term. Because these things for cancer treatment, you do it for 1 month, and after that, gradually you go down to preventive dose.
Yep, very good. Okay, so listen, folks, write it on your calendar. We're talking about stroke next week with Dr. Prasad. Stroke. And there's going to be some discussion too about a number of other things. Dr. Prasad, thank you so much.
Thank you, John.
We cannot say it enough how much we appreciate
Thank
all.
you, Dr.
Thank
you. God bless you.